previously we have seen that cancer was only associated with elderly people. But now we are seeing a very disturbing trend, especially in our country as well, where young people and also, where children are affected by cancer. So what are your thoughts on this? I mean, why do you think that this trend has changed what was there earlier?
No, definitely you're right in terms of the age shift for cancer occurrence, especially compared to the West. In India, we see cancer a decade earlier. So there is a age shift, definitely, but more importantly, why does it happen so, and what is the reason for it? I think one of the significant causes that I think of is there is a change in the lifestyle. Better technology we have today, we have changes in the lifestyle, and also longevity is increasing. Thus, I think putting together all of this, the overall incidence of cancer is increasing. I would rather say India is going to be the cancer capital of the world very soon.
It is already a diabetes capital of the world.
Yeah, it is. You see, today, the food that you eat, the air that you breathe is all contaminated. Added to that, your own personal choices of lifestyle. Right? Maybe tobacco chewing, maybe tobacco smoking, right? Maybe lack of physical activity, right? So, in that way, I think unhealthy diet is contributing significantly. So, putting together all of this, it's a complex, not one factor alone can lead to, but all this put together, I think that's where we see that India is facing a big problem.
So I think you stressed a lot enough about lifestyle diseases.
Yes.
So what do you mean when you say that a lot has changed, the lifestyle has changed, and also if we have to talk about modifiable risk factors.
Yes.
So because we do not know why some people get cancer and some people do not get cancer. So how would you like to explain this?
Yeah, I think coming back to your question of risk factors and why you see cancer incidence so high and what are the modifiable risk factors. So I always say one important formula called 4-4-80. 4 stands for 4 modifiable risk factors, which lead to 4 non-communicable diseases, accounting for 80% of the deaths. So what are those 4 modifiable risk factors? Number 1, tobacco. Consumption of tobacco in any form. Right, not just smoking, but even chewing. Number 2 is unhealthy diet, which we discussed before. Right. Number 3 is lack of physical activity. Right, and number 4 is excess consumption of alcohol. This can lead to diabetes, cancer, cardiac disease, and respiratory conditions. So in that way, I think overall today we are moving towards a condition wherein actually we are harming our own health.
Most of us, we stress a lot on tobacco and alcohol, and less about diet and physical activity.
Right.
But very less about diet and physical activity. No one stresses much on these, which is actually needed.
Correct.
Yeah.
And I totally agree with you because food is really important. I always say, you are what you eat.
Yeah.
I think the good old mantra, what was there, I think, getting back to that really helps us to have good health.
Yeah. And that's the same thing what we are following with fancy terms.
Yeah.
Exactly. So I think it's more like, your genes or genetics, they load the gun, but your lifestyle choices, they pull the trigger.
Yep.
We have to put it together.
Yeah, you said it right.
Yeah. And then coming to another important aspect is genetics or genes. Right. So do you think that if any cancer is running in the family and the next generation is definitely going to get that, or is there any way that we could prevent that?
Well, I think there are 2 aspects to the genetic aspect. One is, is cancer a genetic disease? Yes. Because unless there is a change in the gene, cancer cannot happen. In that sense, it's genetic. But running in the family is what you're talking about. It talks about the hereditary cancer, right? So hereditary cancers basically, if it, for example, we have all heard about Angelina Jolie effect. She was diagnosed to have BRCA gene mutation. So she underwent a prophylactic breast cancer surgery, and she also underwent prophylactic oophorectomy for prevention of ovarian cancer. So that's because in her family, her mother, her aunt had this ovarian cancer, and the BRCA gene was positive in their family. That's why she underwent a prophylactic surgery.
Yeah.
So given that if in a particular family this BRCA gene is positive, then we discuss the options of risk reduction strategies. Right. Other than that, overall, I think for the common public, hereditary cancers need not be a big concern in that sense, because if you look at the total number of cases, about 5 to 10% only are hereditary.
Yeah. And the rest all are.
Rest is all sporadic.
Yeah.
About 70%, I would say, of them is environment and, the lifestyles.